Hello, I'm Dr. Dennis McKenna. I am so proud today to be joined by John DePaula. John, welcome.
Thanks for having me here, Dennis.
John is a Senior Vice President, he's a Chief Administrative Officer, and he's the Executive Associate Dean in the college.
Correct.
And John, I asked you to join today because really we're going to talk about the employee celebration yesterday, which you were a huge part of, and we'll get to that in a couple of minutes.
Excellent.
Okay, so it's great to have you here. And today is Friday, September 10th, bringing you the update from Albany Med. All right, John, we're going to talk about some COVID numbers here. We'll pop up the first graph. You can see in New York State currently there are 2,427 people in beds with COVID. And on that graph, you can see that is a relatively flat graph now. The slope seems to have dropped off, and we seem to be plateauing across the state. Next graph is the capital region, and that number is 150. And that number is going up by about, I think, 10% since a week ago. But we're watching that number very carefully. Here's the graph of what's happening inside Albany Medical Center, admissions and discharges. What you can see here is that the number of admissions per day is going up a little bit, but it's balanced generally by discharges. And then we ultimately get to the last graph, and this is really where I think the numbers are that people pay attention to. Inside Albany Medical Center right now, we have 34 people in hospital beds with COVID. Let me give you some breakdowns. 29 adults and 5 pediatrics, so we'll get back to that 5 pediatric in a second. Of the 34, 23 are on the floor, 11 are in the ICU, and 2 are on ventilators. John, it should be said that as we do rounding through the hospital, as we talk to our doctors and nurses and our respiratory therapists caring for people in the hospital with COVID, the people who are in the ICU, the people who are on the ventilators are overwhelmingly, the majority are unvaccinated. And in general, they tend to be the same patient population we saw in the past. So people who have advanced age, diabetes, hypertension, lung disease. So again, we are seeing some breakthrough cases of people who are fully vaccinated and get COVID, but those who are the sickest, those generally tend to be the unvaccinated. Over the last 7 days here inside Albany Medical Center, we've had 27 admitted and 20 discharged, so 7 more in and out. In the last 3 days, we've actually had 9 come in and 13 go out, which means that over the last couple of days, we've actually had a decrease. And that just means that on a day-to-day basis, it's hard to judge it. You really have to look at it over the course of a couple weeks. So I think, as Dr. Venditti and I say, it's generally in balance right now, maybe a slight uptick, but nothing like we saw a couple months ago. So a reminder to everybody about the vaccines and the vaccine clinics that are coming up. Please pay close attention to the messages that are coming out on that.
Absolutely.
Last thing on this issue, respiratory syncytial virus is another virus that primarily children get. It's a seasonal virus. We see it often in the wintertime, and we currently have 14 children in the hospital with that. Why do I mention that? I think it just provides some context. COVID is certainly something we take very, very seriously, and we want people to be vaccinated for it. There are other things out there that can cause people to land in the hospital, and RSV is one of them, and we're able to care for that population as well, often on our peds floor, our pediatric ICU, and our neonatal intensive care unit. All right, let's change gears and let's talk about the picnic. So I have on the T-shirt from yesterday. I know you wore yours for like 7 hours yesterday. You were there all day, so yours is in the laundry.
Yep.
Some of us had the board meeting yesterday, which was unfortunate scheduling, just something that happened. Was able to get down at the end. I love the picnic. I usually like to get there for the full time. I know you were there the full time. John, thank you. And who else should we thank for this tremendous celebration?
My pleasure, Dennis. It was a great day, and really Bob Pistilli and Scott Heller have been our 2 leaders the past couple of years that have really coordinated the event, and they did a remarkable job yesterday. I mean, really just absolutely flawless with how things ran. And when you think about it, Dennis, you know, we gave out 5,000 meals yesterday.
Incredible.
So 5,000 employees came through, and you know, they got some barbecue, some beverage, some chips, and some other things that we had there, snacks as well. Not an easy thing to do logistically, but credit to Bob and Scott for really organizing things well. And also we had about 120 volunteers of our staff, and really those volunteers came from all of our areas, all of our entities. So the hospital employees and managers, practice employees and managers, center employees and managers, and college employees and managers all play a big part in serving our staff, doing different things to get the products there available, ready to go, sorted out. So again, really appreciate the volunteers.
So John, let me jump in very quickly, and then I'll let you go
Yes,
back
sir.
to what you want to say. Just to say, I also want to thank those individuals for sure, and our volunteers, and I think our epidemiology team, as far as coming up with a safe plan on how to do this. It's like we talked about at the safety brief yesterday. The world today really, I think, is asking us to find ways to be mindful of the fact that people need celebrations, right? It's been a long year and a half, and it's very important that we still do events like this. We can do it safely. I think we demonstrated that yesterday. It's important to recognize our workforce, and again, to the volunteers who made it happen, to you and to Bob and to Scott and to Epi and everybody, I just want to say thank you very much. I saw some people leaving. I got some emails from people when I was doing senior leader rounding last night. Manny stopped and said how grateful they were. So thank you so much. And
Our pleasure, guys.
you know, people seem to be having a really good time.
Yes, they did. Had a great time. And in fact, I mean, you know, when I was walking over, one of our librarians actually
Right.
thanked me for yesterday. And to your point about epidemiology, I really do want to call out our staff as well. Our staff did a tremendous job in in coming to the event masked, staying socially distanced the whole time. They really followed protocol, did an outstanding job, and allowing us to do this very safely. So thank you to our staff as well. And last but not least, I also want to say thank you to you too, Dennis, and our leadership team. Really, you all could have easily sort of passed on this year with some of the dynamics going on. And thank you for trusting the leadership group, the volunteers, and our staff for having this type of event. We appreciate it.
Thank you, John. I appreciate the way you said that, because it really is about trust in your ability to pull this off. Another great thing happened yesterday is I got my flu shot. And for those who went through that, the process is very slick this year. We have this new software program. They just scan your ID, it uploads it, it registers all the information, it will automatically feed into our health records. I just want to say, I know a lot of people put that in, and so we appreciate IT, and we appreciate employee health, and obviously Epi again, but that process is great.
Yeah, and 360 of our staff, Dennis, took advantage of it yesterday. Some people specifically came to the event asking if the flu shot was going to be available, and we're very pleased to hear that we were offering flu shots. So it's always an excellent touch to our event.
So John, you and I have done events like this before. I know that you come in on the week before Thanksgiving, and we do the nighttime meal and stuff. We have so many members of our workforce who volunteer for these things. Obviously, we can't name them all. Many of them you see walking around with these shirts, and it's fun. It's lots of fun. You meet the workforce, and it was a great day. So again, thanks again.
You're welcome.
All right, very good. So that's it. We really wanted to end the week on a positive note, and I think talking about the celebration will do that. And again, thanking everybody who made that happen. We're keeping a close eye on COVID numbers, and we'll talk more about that next week. And I think Dr. Venditti will be back next week as well.
Great.
So we'll look forward to seeing him as well. For those that are working here this weekend, we appreciate you very much, and we thank for everything you do around the clock. We'll see you next week. We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.